Ma'am, we are live, Manjula, ma'am. Yeah, okay,
So can we start? Yeah.
Yeah.
Good afternoon, everyone. It's my pleasure and privilege to welcome you all to this very, very interesting session. I'm Dr. Manjula. I head the Medical Affairs, Regulatory and Clinical Research at Microlabs. Just briefly telling you about Microlabs. Microlab is an Indian multinational company. It is established in 1973. It's a multifaceted healthcare organization. It is present across the entire pharmaceutical value chain. We have research and development to active pharmaceutical ingredient to finished formulation to marketing and distribution in India as well as overseas. Among all the pharma companies in India, we are ranked 20 top pharma companies in India. We have more than 22 specialty divisions with a wide product range. We have more than 550 products and we have more than 6,000 dedicated field force. We are promoting our products. And with regard to our manufacturing facility, we have 14 world-class manufacturing facilities, which is approved by all the regulatory agencies such as US FDA, UK MHRA, Health Canada, WHO, TGA Australia, MedSafe New Zealand, as well as Indian regulator DCGI, with more than 2,000 qualified technical personnel working in our manufacturing unit. Our vibrant presence is there in more than 50 countries across the globe, which includes US, UK, Canada, South Africa, many more countries. We export formulation as well as API in all major therapeutic agents, and we have offices in many countries like US, UK, and we have manufacturing unit in South Africa, Dubai, and many more countries. And we have in India 3 research and development R&D center. We have more than 400 experienced scientists which are working here. Our GDA Foundation runs the Surana group of institutions, which includes Surana College, Surana PG Center in Bangalore, and Srimati Paribai Chunilal Surana Charitable Trust, which also runs 2 important Jain temples, Sushil Dham and Mata Dham in Attibele and Bangalore. That's about the Microlab, which is really doing a lot of scientific research and scientific activity also. And we are happy also to get associated with the Association of Healthcare Providers India, as well as of late ANEI, the Academy of Nurses, through our Micro Knowledge Academy, which is a non-commercial education body of Microlabs, which is involved in only scientific research and educational activity. So we had, all of you had a very nice week this week starting from 5th May. We had the privilege to get associated with both. We were actually last year, many years associated with Healthcare Providers of India Association, AHPI, but we have the privilege of getting associated with ANEI this year, so that we are doing much more educational activity in this regard. I'm sure you had an excellent scientific, I can say, extravaganza or festivity of science this week, and today and tomorrow you have 2 more new topics. Today's topic is really interesting and which is very, very new and a very specialty kind of a topic, nursing informatics, where nursing science with the multiple informatic and analytical science all will come together for better patient outcome as well as the clinical outflow among the healthcare professionals. So we have Dr. Elizabeth giving us all the knowledge about nursing informatics. To go back to this event, we had this year, we have planned a lot of activity with association with ANEI team to conduct AHPI Micro Nurses Academy and ANEI CMEs. We have more than 3,000 nursing head and staff registered in. In each of the webinar, we are getting a very good response. We have more than 500 nurses getting engaged in all the scientific activity on an average. Next slide, please. And we extend our sincere thank to AHPI team for helping us to conduct this MNA, which is Micro Knowledge Academy activities entire year. Our special thanks goes to Dr. Gridhar Gani, Dr. Alex, Dr. Sunil, and other key members of AHPI. And we also extend our heartfelt thanks to ANEI team for finalizing this MNA scientific session. And special thanks goes to Captain Ajita Nair, Lieutenant Colonel Dr. Aji, and Dr. Rosaline ma'am. Next slide, please. And this is the today's session. We have really exciting session. We have speaker as Miss Elizabeth, and our moderator is none other than Dr. Rosaline ma'am. Next slide, please. And I have pleasure and privilege to introduce CME coordinator, whom you know very well, does not require any introduction, but as a formality, as a privilege, I'll be doing so today. Today's our CME coordinator is Dr. Rosaline ma'am. She is the principal of Madras Mission, Principal of College of Nursing at Madras Medical Mission, Chennai. She's the chair of Educational Committee, ANEI, and she's also vice president of TN chapter of ANEI. Her professional experience includes since 1992 till date. She is currently the principal of Madras Medical Mission from 2013 till date. She's been the principal of Indira College of Nursing. She's the vice principal of Labs-AHPI-ANEI College of Nursing. She was also lecturer and reader in the same college. She was also served as a staff nurse in Saudi and tutor in the Clinical Institute of School of Nursing at CSA Mission Trichy, and she's been the also as the staff nurse at CSA Mission as well as CMCH Vellore. Her professional responsibility includes she's the Senate member in the Tamil Nadu Dr. MGR Medical University, Board of Studies member at Dr. Savita University. She has presented more than 70 papers at national and the international conference, and she is the resource person in various national and international conference forum, and she has delivered the keynote address at WHO Day, Midwife Day, Nurses Day, etc. And she is the chapter former for the Secretary of Society of Midwives, and she held that post for more than 5 years. She had several awards and accolades to her credit. She's received Best Outgoing Student Award in MSc Nursing from Labs-AHPI-ANEI College of Nursing. She has received Best Teacher Award from Tamil Nadu Dr. MGR Medical University. And she has received cash award with a citation as a token of appreciation for enrolling the nurses at Trained Nurses Association of India headquarters. Dr. Rosaline ma'am, it's our privilege and pleasure to have you as the coordinator, and thank you very much for, it's a type of a course which you have actually a brainchild of yours. You helped us in conducting as a course director. You have formulated the course and you have helped us in conducting. We really sincerely thank you for that. May I now request you to kindly take over and conduct this mission. Over to you, ma'am. Thank you so much.
Thank you, Dr. Manjula, for that elaborate introduction. Thank you, Microlab, for along with Captain Ajita. I had the privilege of, the 7 days of webinars were designed, and we had the pleasure of coordinating with various people who are in the higher positions who could be able to speak on these webinars. Thank you so much for choosing me for that. So I just want to say a few words about the Association of Nurse Executives India. It is a group of, nursing stalwarts, I can say, who have taken up the initiative so that we will be able to work on the upbringing of the nurses. As you know, the trend is changing. So I am in the education field, so I know how difficult it is to mold youngsters. Okay, so we need to brainchild these children and start to bring up so that the quality of nursing care would never decline. So that's how the Association of Nurse Executives India, with like-minded people, are trying to reach out to various hospitals and also to educational institutions. So I, as the chapter chairperson of the education committee, we have chosen 100 case studies to learn from errors, so that all of us are tend to make mistakes, but we try to cover up mistakes. Once we cover up, that mistake becomes a big error. So with that in mind, the Association of Nurse Executives are bringing about 101 case studies, and those are all in our YouTube channels. Kindly, when you get time, participants, listen to that. That will be a great learning for young nurses or novice nurses. So today, I won't take much of my time. So once again, a good afternoon to all. It's a pleasure to have an eminent person with you, Ms. Elizabeth David, who is going to present to us about nursing informatics. So a brief introduction. There's a lot of things to tell about Madam, but then we will just briefly introduce to the audience. She is a change management system healthcare leader and a leader mentor with 25 plus years of experience in the clinical practice, academic teaching, program development, and administration. Her career has included work in all domains of nursing, including practice, education, research, administration, policy, and advocacy. An all-round development person in informatics has been chosen today for you to get her thoughts from Madam. So in her most recent association with Sir H.N. Reliance Hospital, she started as a Chief Nursing Officer and stepped up to the Director, Strategy and Organizational Excellence. She's a certified NABH assessor for hospital accreditation and nursing excellence. She strongly believes in patient-centric, evidence-based care and has taken up the leadership role in driving institutes towards quality accreditation and constantly working on projects moving towards organizational excellence. She has built effective international nurse training program for hospitals such as South Nassau Communities Hospital in New York and the Mediclinic group of hospitals, Life Healthcare and Netcare hospitals in South Africa. To ensure implementation of best practices, she has spent considerable time at the Johns Hopkins Hospital and has worked closely with some of the senior nursing leaders from Johns Hopkins. So nursing informatics is a growing field, and especially for nurses, we work with people, right? The doctors may come in and go as nurses. We work closely with people, and the information system, the process is set in line through nursing informatics. So today, Ms. Elizabeth David will be deliberating on nursing informatics. Over to Madam for the session.
Thank you very much, ma'am, and thank you very much, Dr. Manjula, as well. Wish everyone a very great evening, and I'm looking forward to spend the next about half an hour to 45 minutes talking about nursing informatics. I also want to thank ANEI, Microlabs, and AHPI for giving me this opportunity to share my thoughts. Without much ado, I'll really get onto the topic, considering the time constraint. Is my screen visible?
Yes, ma'am.
Okay. Right. So, well, we're talking about nursing informatics today, and I'd like to start off with my first slide with this quote, which says, "It is not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change." And this is a quote by Charles Darwin. And to put a little more stress on why am I talking about this particular quote here, I'll go to my next slide. Now, the slide has got a lot of, earlier companies that was into existence, and a lot of these brand logos are there here. I've not changed my topic. It is the same topic that I'm talking about. But the reason why I want to show all of these here is because these were very eminent organizations to start off with. But they failed somewhere down the line because they were not able to keep up with the new technologies that were coming into play. The advanced digital technologies were not adopted by them, and that is the reason they failed somewhere down the line. So what I want to say is that change is inevitable. And if we cannot keep pace with this change, we are probably going to be on the losing team. So coming back onto nursing, do we think that nursing has transformed? I think it has. We have transformed. We've come a long way from what it was then to what it is now. We've come from lifting patients manually. I still remember, and I'm sure Dr. Rosaline will also remember, when we had to lift up patients in our clinical areas, we had to have 2 or 3 people to come together to lift a particular patient. Backs were broken, no time to have food, and all of those things did happen. But now we have equipment like these. We have things like a hoist, which is available in the units to aid us to be able to lift and move patients. Now we've gone to the next level beyond this, which I will come a little later. There was a time when we had to keep a watch and we had to count, in terms of seconds into how many drops are going as an IV fluid. But now we've got infusion pumps, which are automated, and we have it available for IV fluid infusions. But now it's time to move on to the next level of transformation. And that is what we're calling as digital transformation. And why are we talking about digital transformation? And what are the driving forces for digital transformation? So, in today's world, whether you want to order a pizza or whether you want to look at financial security, there is a new technology that is changing the way we live our lives almost every day. So now, more than ever before, new technology is finding ways to impact the healthcare industry. And this makes it more important with the report that was released by IOM. It said the future of nursing, leading change, advancing health. Now, this was a report which was released in 2010, which looked at 10 years of the future of nursing practice. And they suggested that the nursing workforce of 2020 will primarily be technology-based, which requires high-tech informatics skills. And this report was driven by the legislation of Affordable Care Act 2010, and its objective was to overhaul the healthcare system. So this is about nursing practice. There was another report in 2015 by the NLN, the Nursing National League of Nurses. They issued a call for further action to prepare students for a technological future in healthcare, highlighting a clear need for nursing education to teach about technology, to better inform about healthcare interventions that improve healthcare outcomes and prepare a future nursing workforce. So we're talking about nursing practice and we're talking about nursing education, where technology is going to play a very big role. There was a recent survey conducted of about 600 professional nurses, and it was found that 82% of them agreed that new technology and equipment innovation will positively impact patient care. Now, why is it important? It is important because if you look at this particular study, which was done in Queensland, Australia, and this was a study which was published in the Lancet in the year 2022, what they identified is that health outcomes improve when nurses are required to take care of fewer patients, and that investing in more nurses pays for itself twice over. So there were a lot of benefits that they understood when nurses were taking care of lesser patients. So what they found is that the deaths were reduced. So the 30-day mortality rates decreased by 10%. The admission rates, that means there were 7% fewer patients returning to the hospital within a week, and the patients left the hospital 3% faster. So those were the benefits that they got when they reduced the nurse-patient ratio. And what would it do to the cost and benefit analysis? So they had to hire about 167 nurses to reduce the workload of a nurse by one patient. So that cost them an X amount. And when they went on to analyze the savings that they got out of all of these positive benefits, they realized that the savings were double what they spent for the expense in terms of hiring nurses. So obviously, it is always beneficial to have more nurses. But the problem that we have is different. The problem we have is, although WHO recommends a nurse to population ratio of 1:333, in India, we have a ratio of 1:558. So the problem that we have is an ongoing nursing shortage, which is not only in our countries, but many countries around the world. And that is why there is a need to implement technology to support nursing activities, which is becoming increasingly necessary in order to keep pace with the demands on health services. So we have innovations which can relieve some of the burden when it comes to many repetitive tasks that nurses are doing, and it can help nurses manage the numerous time-consuming responsibilities. So that brings us to this topic of nursing informatics. So I just want to briefly, kind of mention the definition of nursing informatics. Nursing informatics is a combination of computer science, information science, and nursing science. So what does it do? It is designed to assist in the management and processing of nursing data, information, and knowledge to support nursing practice, education, research, and administration. So basically, when you're looking at healthcare, especially now, earlier on, healthcare would be, all your documentations were manual. It was very difficult to get out a lot of data out of those manual records. But today, because we have electronic records, we have a lot of digital technologies, it is easier to get in a lot of data. But once you get that data, it is very important to make the data valuable. So that data has to be converted into information. And that information has to be then applied to get knowledge and wisdom to generate more data. So that is how nursing informatics works. So you get data, you convert that data into information and knowledge, and you use that wisdom in education, research, administration, and practice. So that is the crux of nursing informatics. Now let's try and understand what are the various technologies that are transforming nursing practice, nursing education, nursing research, and all of that. So the first technology that I'm going to talk about, there are 4 technologies that I'm going to talk about here. The first one is electronic health records. Second one is artificial intelligence. The third is virtual reality. And the fourth is medical Internet of Things. We are not going to get into the details of the technical aspects of it because I'm not an expert for that. So what I'll be talking about is the application of these technology into clinical practice. So we'll first talk about electronic health records. So what is an electronic health record? An electronic health record, as you can see in this picture here, is everything of a patient put together. But before I go on to electronic health records, let me just briefly talk about EMR, which is electronic medical record. That is an element of electronic health record. So what is an electronic medical record? This electronic medical record is a digital version of a patient's record, which is stored and maintained by one provider. So if a patient gets admitted to my hospital, I will have an electronic medical record for that particular patient. So it's a record maintained by one provider. It includes all the patient's information and details from in that particular hospital. So if a patient gets admitted to another hospital, they will have a separate electronic medical record for that particular patient. So that is an element of electronic health record. So that brings us to electronic health record. So what is that? Electronic health record consists of a patient's records from multiple sources. So let's say a patient gets admitted into my hospital, Rajagiri hospital, and then gets admitted to Aster, which is my neighborhood hospital. So Aster will have an electronic medical record. I will have an electronic medical record, but there would be one electronic health record for the patient, which will consist information of all these electronic medical records put together. So what is the advantage? It gives a complete overview of the patient from a long-term view, actually, of the patient's health, available in all different information and sources. So even if the patient does a lab test somewhere, that will be a part of his EHR. If the patient buys medicines from somewhere, that will be part of the EHR. If patient has a home health service done, that would be part of EHR. So all of these are put together into an electronic health record. So what are the advantages of having an electronic health record? Obviously, the first important advantage is better quality of care. So when you're talking about better quality of care, what happens here is you get, of course, a very comprehensive patient view. There will obviously be reliable prescribing because you're getting to see the whole information of the patient right from the very beginning till whatever records you want to see. There is a patient involvement because there's a patient portal and they will have access to their own records. So they have it with them as well. There is better coordination of care and decision making. There is in the sense, when I'm saying better coordination of care, one doctor can communicate with another doctor to ensure that there is care coordination. There are streamlined workflows, and imagine the power of data that we have. We are having a whole humongous world of data for us, which is something that we're going to use for our future research and make medicine or medical science a better, better thing for people at large. There's going to be better patient and physician communication. There will be more accountability, and there will be error reduction. When we're talking about error reduction, imagine in today's world where you don't have an EMR, some of the hospitals may have hybrid, in the sense their billing and the rest of it will be on the electronic record, but the rest of the clinical notes will be on paper. So what really happens is the doctor will prescribe some medicines, the doctor will write an order for an X-ray or an ECG or whatever, and the nurse will then have to raise it onto the system because billing is electronic. But in that bargain, you will end up having a lot of errors because the nurse may end up copying, kind of selecting the wrong diagnosis or selecting the wrong test or selecting the wrong medicine. And all of these leads to a lot of errors. So there is something called a CPOE, which is closed physician order entry. So when you're talking about closed physician order entry, what basically happens is the physician can order his prescription directly onto the system, and that converts as an indent to the pharmacy. So there is no process of transcription. There's no process of the nurse indenting a separate medication for the patient. When it comes to diagnostics, the doctor can directly raise an order into the system, which converts to an order to the diagnostic units. There is something called as barcoding, where patients can be barcoded, their ID bands can be barcoded, medicines can be barcoded. So usually we have a lot of instances of patient identification errors, medication errors. So when there is a barcode, you can scan the barcode and you will, the system will ensure that you have the right patient available for whatever service you want to provide. Plus, in addition, with EHR, you can also have a lot of patient alerts and reminders. The second benefit is interoperability. So when a patient is going to see multiple specialists and able to manage chronic conditions such as diabetes, or if a patient is planning to transition to a home care environment, they can still have the EHR available. So it allows interoperability. Accurate patient information, because all data is available at one location. You don't have the patients having reports which they have lost or they don't have it. Those kind of things are not happening. So you have accurate patient information, which is real time. Accessibility, online access makes EHR accessible anywhere. A patient can log in from any location as long as there is an internet-enabled location. And these tools let providers collaborate with one another. So if there is, let's say, a doctor who's probably in a tier 2 city or a tier 3 city, he can communicate and collaborate with a doctor who is probably from an advanced care facility, and to ensure that the patient is getting the right treatment. Then coming to support. Now, when we have an EHR, obviously the vendors will provide you complete support 24/7. They also provide on-site support, which significantly can reduce your IT cost. Now, coming on to security, obviously EHR has to be highly secured. So there are certain standards that you need to be compliant to. And if you're able to be compliant to those standards, the records will be protected. Customization is possible because every facility works a little differently than the others. Your workflows may be a little different than the others. So with EHR, you can always customize the requirement as per your facility's needs and processes. Scalability is definitely possible if you have an EHR. If your EHR is catering to one particular region, you can always extend and expand its usability to another region as well. Then talking about revenue. So with EMR, it definitely provides billing and payment tools. So that reduces rejection rates for insurance claims, and it also increases the first-time acceptance rates for claims. Governments are also now talking about providing monetary incentives for EHR users. That is to enable and ensure that the hospitals are using EHR. Coming on to increased efficiency, there are a lot of built-in templates for physicians. They can build in favorites. So when you're talking about prescription, they can put their favorite drugs or their favorite prescriptions for a particular diagnosis. That reduces a lot of time that is being consumed when they're writing a prescription for every single patient. It also, AI can be used along with EHR, which will aid with diagnosis and interpretation of reports. It also reduces the abuse of controlled substances. It automatically checks for allergies, etc. So that builds in a lot of efficiency into the system. So coming on to artificial intelligence, since we've talked about electronic health records, how do you define artificial intelligence? Niti Aayog has put in a definition for artificial intelligence, and that is the aptitude exhibited by smart machines through perceiving, thinking, planning, learning, and the ability to manipulate objects. So that is a definition of artificial intelligence. Now, there are a lot of applications in artificial intelligence which gives you certain, which are used in certain fronts as far as nursing and clinical care is concerned. The first important AI-driven clinical application is data collection. As I said, this is a treasure for us. Well, this is like a priceless treasure, the data that we're holding because of these technologies. So through wearable devices, nowadays, a lot of people will have smartwatches, smartphones, all of it, which can get in a lot of data to us. And this data can be used to monitor symptoms and behaviors. You can even set reminders. Let's say you are monitoring your blood glucose level, you have sensors available. So if you have to take an insulin at a specific period of time, you can set in a reminder. You can, there's also a facility for voice recognition, which can assist with documentation. So let's say a lot of you have sometimes doctors who are finding it very difficult to document onto the electronic medical record. So you have voice recognition where you can speak onto the application and that will automatically document it for you. You can just check it and then upload it. So all of these facilities are available. Coming on to early detection, which is the next clinical application. So through predictive analysis, AI can forecast trends, let's say even in public health issues. It can forecast if there is an expected communicable disease outbreak. It can forecast if there is a patient who's likely to develop complications like sepsis or anything during the hospital stay. So that is called early detection through predictive analysis. Coming on to nursing education. Students can be put into an incredibly realistic simulation environment, which is AI-powered, and they can run simulations into different patient conditions, changing symptoms, changing values, and you're expected to respond to those particular situations. So what really happens is you're building up nurses who are critically very, very strong. They're thinking very well to understand how to manage a given particular situation. The last application is clinical decision support. So with all the data that you have, AI can help doctors and nurses make decisions pretty quickly and confidently. So let's go to certain technology, AI technology, and see how it is helping us individually. So this is my personal favorite, very exciting. It is, they are robots. So robots that are available in healthcare, if you look at what you see out here, the first robo is a nursing assistant kind of a robo. So as I said, initially, we used to actually manually move patients, transport patients move patients from bed to trolley or, chair to bed or whatever. It had to be a manual activity. Then you got something like a hoist, which needed our assistance, but you could, it kind of aided us. Here you have a robo, which can actually lift a patient and move the patient from one location to another. So the nurse is completely free. She just has to supervise and ensure the patient's safety is taken care of. The second robo that you see is a service delivery robo or a logistic robo, as you can see here. So what is the function of this particular robo? In case you want to transfer some item from one place to another place, from point A to point B, or you want to want the robo to go and give something to a patient. Let's say the patient is asking for a hand towel. So the nurse need not be occupied with that, nor does the nursing assistant need to be occupied with that. You can use a robo to get that done. So these are little mundane routine activities which does not really need clinical insights or knowledge that can be transferred on to these robots. The third robo that you see is like a telepresence robo. This robo has become very famous during COVID. So in case of such situations or such clinical conditions, when you don't want to make multiple visits into a patient's room who's probably having an infectious disease, you can send your telepresence robo and the robo can communicate for you to the patient, and you can actually observe the patient while the robo is communicating to the patient, and you can speak to the patient as well. This robo can also check the vitals, can check temperature and all of that. The last robo that you see over here, the fourth one, again is a nursing assistant robo. So this nurse wants to turn the patient, and it's usually, again, you need multiple people to be able to do that. But as you can see over here is what is the robo arm, and that arm is aiding the nurse to turn the patient. So what are the other robots available? You have surgical robots, which are useful for training. You have exoskeletons for aiding with patient rehabilitation. You have smart prostheses and bionics. You have assistive robots, therapy robots, cleaning robots, which help for cleaning and disinfection. Logistic robots we already spoke about. Telepresence also we talked about. Pill robots, which can help in pill management, and especially in hospitals where you do single pill dosing. You also have robotic nurses and surgical robots. Coming on to the next application, that is visual recognition. So if you look at here, what really happens here is that the application can compute physical images and streamed videos to identify and diagnose conditions, especially in case of skin diseases. Let's say you have a skin disease and you want to have a teleconsultation with the doctor, or you have an online application. You can take a picture of that skin disease and the AI will help to analyze or give you a tentative diagnosis of what could this disease be. The AI can also monitor breathing patterns and kind of come to a conclusion on what is the problem. It can also identify non-verbal cues for pain, anxiety, or depression, and kind of come to a conclusion on how much is the pain, is the patient having anxiety, is the patient really having depression. So all of these things can be done by AI technology, which is called as visual recognition. Coming on to voice recognition. Now, this is something we all know. We all know about Siri. We all know about Alexa. We all know about Google Home Assist. So what are these devices doing? They are doing voice recognition. So how do they help in clinical practice? Voice recognition is some of the most simplest things that we do. Let's say you want to search for a particular document. You want to search for a particular policy. You can just say, hey, I'm just using the word Siri. Hey, Siri, please help me to find my policy on fall prevention. And that can come up to you. So the amount of time that is being wasted on all these searches can be reduced. You can set certain times and reminders for performing certain nursing tasks. Many a times we tend to forget something that you have to do for the patient. We are all human beings, that can happen. So you can set reminders to make sure that you do not miss such kind of an activity. Now, coming on to patient experience, how can you improve patient experience? The first thing that you can have is a intelligent healthcare voice assistant. So let's say a patient has got certain symptoms, and if he tells what are my symptoms, maybe he have a question concerning some symptom that he wants to talk to a doctor. So you don't need to engage a doctor all the time. If the patient is able to tell those symptoms, the voice recognition application can help you to identify what is the kind of diagnosis that may have, or if they want to talk about some medication side effects, or if they want to set up an upcoming test schedule. So all of these can be done with voice assistant. So you just have to tell, I need to have an ECG done on the 21st of May, 5 p.m. So the system can update it for you. You can set real-time medication reminders and virtual care. You can actually book an appointment with a preferred doctor with the use of voice recognition. Coming on to the next one, AI technology, that is machine learning and deep learning. So what does machine learning do? It processes information using complex algorithms and then improves automatically based on learned experience. So basically, this is what we all do, right? When you have a novice nurse, they don't know a lot of things, but as they look at data, they'll come to know, oh, if the blood pressure is lower, then probably this patient can have orthostatic hypertension. So if the patient has orthostatic hypertension, this patient is at a high risk of fall. So all of this comes with experience and with a lot of data that you are dealing with on a daily basis. And that's exactly what is machine learning. So what can machine learning do? It can predict readmissions. It can say that probably this patient may come back to you with this particular situation. It can diagnose heart failures using electrocardiograms. You can identify a patient's course in the hospital, and you can initiate and complete a certain task automatically. For example, if a patient is getting discharged, let's say, and the discharge summary says that you need to follow up at the OPD after a week, the system can automatically schedule an appointment for that particular patient and also send in a notification to that patient that your appointment is scheduled for so-and-so date at so-and-so time with so-and-so doctor. And the information can also be sent to the doctor saying that you are expecting a patient on so-and-so date. So all of these things can happen automatically with machine learning. Now coming on to deep learning. Deep learning is a subset of machine learning. it is a little more complicated and a deeper form of learning where it actually mimics the human brain. So what does it do? With deep learning, you can automate the interpretation of electrocardiograms. So it can happen that an electrocardiogram is taken and the system will automatically give you the diagnosis for that electrocardiogram. You have a lot of smart watches and all of that available. So this can automatically tell you, oh, you've got an atrial fibrillation. So these are deep learning technologies which are inbuilt into a lot of these wearable devices. Coming on to the next application, that is expert systems. So what does expert systems do? This was actually introduced by a university, Stanford University Computer Science Department. And they said that this is a computer application which can solve most complex problems of any specific domain. It is considered as the highest level of human intelligence and expertise, as it is based on the knowledge acquired from an expert. So if you look at this image here, this is an expert. So the expert will give you a lot of knowledge, which is kept into a knowledge base. Then there is an inference engine which converts that knowledge. It kind of analyzes the knowledge, comes out with analysis and conclusions, and can give advice to a non-expert user, right? For example, all of us have downloaded the Arogya Setu app during COVID. So it kept asking you questions. Do you have cough? Do you have fever? Yes, no kind of questions. So what did it do at the background? It was analyzing. There was an inference engine that was working on the behind of those question answers that you gave. And based on the answers, it did an analysis and it would come back and tell you that you're not at risk for COVID at this point of time. So that is how an expert system works. Now, coming on to virtual reality, again, an exciting world of virtual reality. This can be utilized in a lot of clinical practices, especially education. So what does it really do? It visually immerses the user with simulated objects and in a completely different virtual environment. So imagine if we can have our nursing students having that VR camera and getting virtually into a human body. You can actually feel the organs. You can actually know where the organs are located. You actually know how many bones are there. You can actually count the number of bones. So all of this becomes very, very clear. So the applications in nursing are for clinical practices. One is it can aid with psychological treatment. So let's say someone has got depression or anxiety. If you use virtual reality, it can help in management of this condition. Let's say for pain management, especially in severe pains, for example, burn victims. When you're providing burn care, I still remember we used to go to Kasturba and all of these hospitals, and it was in terrible pain that patients used to be when we used to give them the burn care. So for such patients, if you use virtual reality, it can distract them from that moment, and it can aid in reducing the perception of pain. Clinical training, of course, virtual reality, simulation, all of this put together can transform the way we teach our young nurses, and they can become better equipped when they come and face the real world of practice. Complex surgeries, a surgeon can actually perform a complex surgery in the virtual world before he does it onto a patient. Let's say it's a very complex surgery, probably it's got a very small percentage of survival, or it's highly risky. So the doctor can perform that complex surgery in the virtual world and then go and perform it onto a patient in the real world. So you're greatly improving the confidence of that particular surgeon and obviously the outcomes of the patient. So you can also use virtual reality for physical rehabilitation and cognitive functioning. Now coming on to medical Internet of Things. It's also called as IoMT. So what are these devices? IoMT devices are a type of IoT technology, Internet of Things technology, that enables medical devices to communicate autonomously over a network. The data that is collected can be transmitted to healthcare providers via IoMT networks with limited or no direction from the patient or medical professional. That means once an IoMT network is implemented, you really don't have to be actively involved in that to get data. Data keeps coming. So I've had the privilege of implementing quite a few of such medical IoT devices. So the first one is remote patient monitoring. So you have a lot of wearable devices which uses medical IoT. So we've been now looking at two important medical devices which can do remote patient monitoring. And the idea here is to ensure that patients can be, of course, monitored real time. And there are mechanisms wherein you can set the limits, and if it goes beyond, above or below that set limit, it can give you an alert. So you don't miss any adverse situation in a patient. Vis-a-vis a nurse who would be checking a patient every 4 hours or 6 hours, but we don't know what really happens in between those 4 hours and 6 hours. And there could be times when nurses miss checking on the patient as well. So that is why we're looking at, looking at having remote patient monitoring systems installed. Connected inhalers. These are inhalers which can be used by, of course, patients who are asthmatic. But what really happens here is it can keep a track of the amount of medications that a patient has taken. It can keep a track of the timing of when the puff was taken. And it can, kind of correlate some data on the time in terms of what was the environment around, what could have triggered that particular asthmatic episode. So these are data that you can get from these connected inhalers. When you're talking about robotic surgery, these are small robotic robots that can be, swallowed, and they can perform very, very minimal surgeries in the body, within the patient's body. So the patient, for small surgeries, which can be performed by these robots, need not undergo a major surgery and, kind of an invasive or a non-invasive surgery in an operation theater. You also have certain other medical IoT devices, which are called ingestible sensors. So these can be ingested by the patient, and it can do a lot of diagnostic studies within the body. There are IoT devices which can monitor for depression and mood of a patient. There are devices which can augment surgery. So we have implemented such devices which will actually track a patient's movement in the OT. So you track the in time, the out time, the surgical safety checklist time, if it was done, not done. So all of these things can be automatically picked up. You don't have to manually sit and do that as an activity. So there is a lot of accuracy in that particular data that you get. Emergency care is when you are able to manage the patient even before the patient reaches a hospital. So in the ambulance itself, you can take care of the patient. The doctor sitting in the ER can monitor the patient from here. He can understand what are the vital parameters, what is changing, what is increasing, what is decreasing, and he can advise the team who's on the ambulance on how to manage the patient. So you're basically starting your management right from the start of ambulance till the patient even reaches the hospital. Glucose monitoring, these are sensors, small sensors that can be embedded into the patient's subcutaneously, and they can keep monitoring the patient's blood glucose level and can also keep triggers of, insulin requirement and stuff like that. Now this was a clinical aspect. Now coming on to a little bit about the administrative aspects, you can also use IoT devices for tracking inventory, tracking equipment, also tracking your staff and patients as well. Because hospitals can be really huge and you may end up not finding staff that you need. So you can utilize this medical IoT devices to track all of these equipment. And obviously nurses spend a lot of time in inventory, and that can be reduced considerably. Pharmacy management, again, similarly, you can use inventory management. You can even use IoT devices to have a real-time continuous monitoring of the refrigerator temperatures, the room temperatures, and all of it, the humidity, the temperature, everything can be monitored real time and automatically. You can also use IoT for virtual monitoring of critical hardware. So you don't have to be there present everywhere. You can use IoT devices to monitor them. You can also utilize them for hand hygiene monitoring and alert. In case someone is not performing hand hygiene, IoT devices can give them an alert on that they have to perform hand hygiene. So coming on to what are the challenges in terms of adoption of technology. Whenever you talk to any hospital about adoption of technology, the first thing that you hear is poor network connections. Yes, so if you want to have digital technologies implemented in your hospital, you need to have a good Wi-Fi connection. The networks have to be really strong because otherwise people are not going to accept that technology. So the problem is not with the technology, the problem is then with the network. If there is lack of enough infrastructure, Let's say you talk about implementing electronic medical record in your hospitals, but if you don't have enough of computer on wheels, if you don't have enough of those cards available, nurses may end up not using it as effectively. So when you're talking about implementing a particular technology, you have to ensure that you have certain infrastructure that is required for that particular technology available. Complicated user interfaces and complicated patient information tracking. So when you look at an EMR, if it looks very complicated, at the first sight of it, you're going to say, this looks difficult. So when we are talking about implementing EMR, it should be easy to the eyes. It should appear easy to use, because already when you're talking about EMR, there's a certain fear. There's a certain fear that will this work? Will I be able to do it? So the more easier you make it for people to adapt, better will be the adoption. Then immediate and wide range technology implementations. Now there are some organizations who are so driven in terms of adopting new technologies. They will want to adopt one after the other. But what is really important is to know that people at the ground level, they need to be able to accept it. So that takes some time. So you need to space your technology implementation so that there is enough of time for people to adopt the previous technology before you introduce a new one. Now coming on to human problems, what are they? One is lack of training. So if you're not able to give enough of training to people on the new technologies, they will not end up using it. Lack of computer navigation skills, not conversant with computer vocabularies and language, lack of time to operate. I mean, you have a lot of times nurses say, we are so busy, we don't have time to operate this. So you have to ensure that the technologies that you're going to use are not going to make life difficult for people. They should make it easier for people to use. Sometimes, rather many times, there's a resistance to change. People say, we've been doing this so long, we've been working with paper so long. Why is there a need to change? We are okay with this. So there is a resistance to change. There is a short span of association with an organization. So when you move from one organization to another organization, you have to unlearn and relearn all over again. So these are certain challenges when it comes to adoption of technology. And in conclusion, I would like to say that I think it's high time that we have to ensure that we embrace technology. There's no other way for it. We have to go forward, because the future of healthcare is going to be heavily driven by technology-enhanced care. We have a lot of nurses who are now getting very active with information technology and being nurse informatics in a kind of a specialty. We don't have it like an academic here, but in hospitals, we have nurses who are designated as information nurse specialist. I have a hospital, in my own hospital, I have a nurse who is an information specialist nurse. And the whole idea being that we are now moving into EMR, and it really needs someone who's going to be able to develop that system for us in a way that it works beautifully well. Second important thing that I would want to talk about here is that we need to revolutionize education. We need to align education with the practice environment. Many a times, especially when it comes to nursing education and nursing practice, we kind of work in silos. We need to connect with one another. The people at the practice need to learn from education, and people at education need to learn from the practice environment. And that's very, very important. Nursing curriculum is very much comprehensive. We have it even revised, I think, in the recent past. But in terms of implementation, there are a few challenges in some colleges of nursing. Many of them do a good job, but some of them are not up to the mark. When you really see nurses coming out from some colleges, you can really speak the difference. You can identify the difference. And informatics needs to be a very, very important element of nursing curriculum. And the third aspect that is very important, again, in terms of digital technology and advancements in technology, is faculty development. So nursing faculty, the teachers are going to teach the future nursing students, also will have to have an element of understanding of digital technology and how it works. So this academic practice partnership, I think, is key to make sure that we're able to work in this, move ahead in this digital world and make sure that we're able to come out successfully. And I strongly believe that as nurses, we have shown throughout history that our profession can rise to the occasion and adapt to patients' changing needs. And post-pandemic era, this is another paradigm moment for nurses. It's a paradigm shift that we're going through. So this combination of high tech and high touch will definitely improve efficiency and quality of patient care. And it will also reduce the nursing frustration when we have many a times in certain hospitals, we have a nurse taking care of 10 patients, 9 patients. So if we are able to use technology, I'm sure we are going to bring in some relief to our nurses who are working at the front end. And it will also lead to significant financial savings also for the organization. So, but having said all of this, I think there are many changes in nursing practice over the years, but there is one constant that is there throughout it all. And I would vouch by saying that nurses are the most essential resources for a hospital when it comes to providing quality healthcare. So that's all from me. Thank you. And I'm open to questions.
Thank you so much, Madam, for taking us through such an interesting topic. Certain areas even I was not aware. Madam has so beautifully dealt on the electronic health record, the artificial intelligence, all of us know, the virtual reality and the medical IoT was something which was new to me. So I'm sure the participants, you have certain questions in your mind. Please feel free to clarify those doubts. Because we are all dealing with people, that is the patients and the healthcare professionals. So as we work with technology, we may have to really learn a lot of things. As the new curriculum by the Indian Nursing Council has developed, a competency-based education has come up with a new curriculum where computer though it was there, but now in depth it has been developed. So I'm sure that will actually add a lot of inputs into the nursing education, and the nurses will definitely develop, the new upcoming nurses will definitely have more hands-on skill on the technology. And robotic nursing is another interesting area which is really growing in many hospitals. It has come up. So we need to educate our students. So the initial part of the presentation, it was clearly shown from where we are to where we are now. Where we were to where we are right now. So we need to get a lot of insights and interest into this. And I'm sure the young novice nurses who are more adapted after the COVID, they are more adapted to the technology. So they will learn very easily. So that's interesting of all this. So we have some, yes, Kavaljit ma'am has appreciated your presentation. Yeah, students aren't developing concept clarity. So we need to give hands-on skill on this, because we don't, with NABH itself, what has happened is certain things like electronic medical records, now the recording, people have a fear to allow the students, because I'm in the education field, I know it's very difficult for the practice nurses to permit the student nurses to touch on something. So we need to actually stand with them and allow them to use these technology, but at the same time, we need to have an observation. Yes, I agree with Suguna. It will take some time for us to implement, and we need to actually train a lot of people into this. So that will actually increase the efficiency and effectiveness of nursing. Any other questions? Yes, exactly. Resistance to change is indeed hindering how to create like-minded nurses to adapt to change. Yeah, exactly. 100% true. Any other doubts from the audience? You can even unmute yourself and ask a question also, because having a person who's ready to answer at one platform is something difficult. So madam is here, so you can clarify your doubts. No doubts? Your presentation was excellent, making it very simple and it was easily understandable. That's what I feel. Many questions have not come up. So the basic competence of every nurse, even a nurse, forget the student nurse, the nurse itself, those who are practicing, we need to give a basic competency education. And information literacy is something which is very, very important. So all these will help us in developing into, our healthcare professionals are really growing, it's mushrooming. So we need to do a lot of education in this part of it. So thank you so much, madam, for sharing your inputs to the audience. I'm sure each one of them have benefited a lot. So today is the 6th session of the webinar. I hope the audience, some of them are connected continuously. So I think you have get rich experience from all these things. So I thank the Micro Lab along with AHPI and
one more
ANEI.
question came, ma'am. Is it okay
Yes.
to take?
Yeah, sure, sure.
It's an audience from Gargi. Excellent presentation, ma'am. Will it overcome problem the shortage of nurses? And what all changes do we need in NSG education?
Nursing education. So the thing is, I mean, we have a shortage of nurses for sure. It may not have a direct impact in terms of reducing the nursing manpower requirement, but what really will happen is it will make nursing care more efficient. Today, if you have a nurse who's spending about an hour and a half taking the vitals of 6 or 7 patients, if she's being able to relieve, if you're able to relieve her of that 1.5 hours, she's probably going to be able to give your patients a better care. You're going to be able to utilize her clinical skills in a better way. So the whole idea of implementing digital technology, at least at this point of time, is to make care more efficient, and utilizing nursing skills in the real sense of nursing skills. That's the whole idea. But when it comes to nursing education, I think the curriculum has already incorporated nursing informatics as an important, Dr. Rosaline has shared that part of the syllabus with me. So yes, there's a lot of input there, but I think it all boils down to implementation. You can just give a theory session of nursing informatics that will not make any sense to a junior nurse in college. But that is where I think if we can have a connect between the practicing nurses and the academic nurses, I think that will bring in a lot of synergy and sharing of good practices across.
Yeah, at this time I want to share that we are doing, ANEI along with CAHO is doing a study to assess what is the time taken on vital signs, the physical presence of a nurse in taking vital signs. And we had data from about 875 clients all over India. ANEI has collaborated, and the research is almost done. So the analysis part of it, the main aim is to reduce the time of nurses in spending, so it's all connected, and then you'll have to just go there and monitor. What we really wanted to see in that is, though an equipment or AI is there, but then your communication with the nurse, with the patient should never be affected. And moreover, when we are educating the students during the induction process itself, we have put in that the nurse will be educated. A part of the induction process itself, the electronic health record also, the internship part of the nursing student itself, she's introduced into that, and she's allowed to start using it so that when she becomes a novice nurse, she's already developed the skill. So she can straight away start caring for her patients. So these are some of the initiatives ANEI is also trying to do so that we will upskill the nurses for the current generation. All of them are tech savvy, so it should be very easy for them to do, but not at the cost of compromising patient safety. So that's our great concern we have. So thank you so much once again. Thank all the participants for patiently listening. I hope all of you have got an insight. Now, listening to something is like, getting a knowledge, and then the right attitude and to implement it is something which is very, very important. So we need to implement in our area of work, or even if you do not have one, try to think about all those things so that we can develop ourselves. That is very, very important. Thank you, Micro Lab, for connecting with AHPI and ANEI. And the topic chosen, the justice was done by all the speakers for the past 6 days. I immensely thank each one of you, wish each one of you a happy Nurses Day, and Vijay for so beautifully coordinating the entire program, and Dr. Manjula for that beautiful introduction. So thank you so much for each one of you for taking time to be with us. Thank you.
Thank you very much. Thanks a lot, everybody. Thanks for having me over. Thank you.
Thank you, ma'am. It was wonderful, wonderful session. We really enjoyed listening to you. I'm sure all of them. And Dr. Rosaline, thank you for conducting it so well. And Vijay, thank you for conducting for entire week. So wishing you all the best for tomorrow as well. Thank you, ma'am.
Thank you
Tomorrow
very
at
much.
the same
Have a
time,
nice
we'll be connecting. So kindly join participants. Kindly join in tomorrow. That's the final webinar, the 7th day. Thank you.
Thank you very much.
Thank
Have
you.
a great
Namaste.
evening.
Yeah, thank you.
Okay.